we can focus on exercise. So I'll just give you some of my thoughts on exercise. So when I think of exercise, the what I can tell my patients is walk at least 10,000 steps a day. If somebody is very sedentary, I go down to 6,000-7,000 and stuff like that. That's all time I have to tell somebody in the clinic that exercise. But exercise is a lot more and a lot detailed than that. So there is a direct correlation between the amount of belly fat and hippocampal volume. So hippocampus is a part of the brain that is responsible for short-term memory formation. People who has a higher amount of visceral fat, their hippocampus shrinks. And that is more pronounced for female. For males, is their muscle volume. So the larger muscles you have, the lesser the larger the size of hippocampus. So most of my elderly, they wanna mostly do cardio exercise. They say, "Hey doc, I'm doing my gardening, I'm going out for a walk. Isn't that enough exercise?" And I say, "No, that's not enough exercise. You need to do some weight training." Why do I need to do weight training? I'm already walking 10,000, 15,000 steps a day. I go out for running. Like, why do I need to do weight training? Well, we have to learn physiology. So as you know, we have red muscle fibers, which are fast twitch muscle fibers. And we have a white muscle fibers. They are slow twitch muscle fibers. Slow twitch muscle fibers are for endurance, like the keep doing repetitive movements. Versus fast twitch muscle fiber generates a lot of force. They get tired very easily, but they can generate a lot of force. Now, what happens if I'm falling and if I'm in one particular direction, that I have to put my foot down and prevent me from falling? That muscle has to generate a lot of force to get me up. So, for example, if I'm down like this, if I have to get up without using my hands, with my legs crossed, that can only happen if I have trained those muscles to do that. If I'm just walking, it won't happen, right? So that's why strength training is very important. After the age of 30, every decade, we lose 10% of our muscle mass. So sarcopenia means loss of muscle mass is very real. It's not a linear relationship. So it's not every 10 years you lose 10% muscle mass. Some year you may have acceleration, and some year you are able to maintain it, depending upon how we use our muscles and stuff like that. So I thought as a part of program, instead of just telling people that you should exercise, I'm thinking about telling them to wear a wearable, like a smartwatch, and have an app. So there is an app called Everfit that will sync with your watch, and we can see remotely how many steps you are actually walking. So when you come to see me at a monthly appointment for this, we can go over your individual parameters that, okay, we talk about walking 10,000 steps, spending 10 minutes for strength training, 10 minutes for stretching, and seems like you did it 25 days a month. That's great. Versus you only did 5 days a month. So then I can give you, do barrier counseling. So person can come say, "Doc, you told me to exercise, but I don't have a gym. I don't have a gym membership. How I'm going to do strength training?" So then I can give you your specific barrier evaluation that, okay, if you want to work on your muscles, do you have a gallon of milk in your home? It has a handles. You don't need to go to a gym. Just use that gallon of milk and do your biceps curls, right? So we already have all those things, but we say, okay, I can't exercise because XYZ. So that's called barriers. And when we meet like this, either me or the health coach can help people go through those barriers